Alright, y'all. I believe I'm live here. I just want to give a health update because some things that got posted was not correct. Um that's okay. It's totally fine. It happens. Um I just want to let everybody know what's going on with my health right now. Um if you've known me, you know that I've had heart and lung problems my whole life. Um I had a heart cath done a week ago, last Thursday, um, to check on the pressures in my heart, stuff like that, because I've been staying tired like all the time. Um, they checked for blockages, which I didn't know they were going to do. Um, but there were no blockages. They will, like I said, they check the pressures, which, it is elevated, but that's normal for my condition. They're going to get the results of my last heart cath from Vanderbilt, which was done a very, very, very long time ago, and compare that to see how much higher they went up, and everything. And um, the hold on a second, sorry. The cardiologist I seen Monday is not my favorite one there. I really don't want to see him again. Um, because of things that have happened in the past, a past experience with him. Um, anyway, sorry, my nose is stopped up or from medication. Anyway, um, okay, the heart doctor asked if I had ever considered, heart and lung transplant, and I'm like, well, I know that eventually will need to happen, but I do not feel like it is time for that yet. So I'm not pushing for that. Cause I just really do not feel that it's time, for something that drastic to happen. Um, Also, they did sedate me. Now, I've never been sedated when I had a heart cath in the past. I've always been awake. But they did sedate me to test that to see how well I could handle it for a future procedure that I'm going to have, um, because I have a fibroid on my uterus. It's like a growth that's caused by hormones. Um, it's, it's causing me problems, and I've started on medication for it that will pretty much make me go into menopause, so it will help shrink the fibroid. And then I'm going this Saturday to have an MRI so they can get a better view of it, because the procedure, they need to see better, I guess, where they need to go in, because the procedure that they're going to be doing to help kill off this fibroid pretty much is they're going to go in through an artery and partially block blood flow to it so it can kind of, kill it off, but not so much to where it affects anything else or affects my uterus. Um, if none of this works, then we may have to look at a surgical procedure to remove it. I'm not sure how things are going to go. I've only been on the medication for a couple days now because it took almost a month to even get it approved and covered through my insurance, because it's, with insurance, if there's another medication that might work, they'll want you to try that. But I got it pre-authorized and it's covered, so I started that. Like I said, I'll have the MRI done this Saturday and then go from there as far as having that procedure done. Um, the heart doctor has called me in another specialty medication because I'm already on one specialty drug. I have to have it shipped to me. This it'll be a new medication. It'll be a breathing medication, like an inhaled medication. Like I guess when you do like breathing treatments, I'm assuming it's something similar to that. I'm not sure. There will be somebody to come out and help me, show me how to use the medication. I have to use it. I have to do it 4 times a day, which is not bad because I've in the past when I was having issues similar to this, they tried me on a couple of different medicines, and one of them was an inhaled medication, and I literally had to take it every 2 hours. And I'm telling you, you can't have a life having to take medication every 2 hours. And it didn't help anyway. There's another medication that he probably could have prescribed, but I think because I've got something going on with my liver that they couldn't prescribe that one. Because I think there's one, like, you get a shot or an injection or an infusion or something once every other week or every other month or something like that. I can't remember how often you'd have to get this treatment done, but we're not going that route because my liver, what's going on with my liver, it's not definitely a transplant because I'm still in the process of getting more tests done to see what exactly is wrong with my liver. I know the pain medication I'm on and one of the lung medicines I'm on can cause liver damage. So I have to go monthly and have a liver function test done. I guess it wasn't picked up on that until recently. I think some of my blood work was off. And so they sent me for an ultrasound of my upper stomach to check all my organs. And that's when they noticed a change in my liver. They did mention cirrhosis. I'm not going to say that's what they're saying it is, but that's what they mentioned to me when they called me about the results. I go in August to see a liver specialist up at UAB. They're going to do blood work. They're going to do another ultrasound of my liver, and then I'll see the doctor to discuss the results, I'm assuming. So that's not until August. I may end up having this other procedure before that. The cardiologist I seen Monday, the reason I don't like this cardiologist, for one, he don't listen to me. And for two, when I had gallstones a couple years back and I had to have a drain tube connected to a bag that was put in through my stomach into my gallbladder to drain these gallstones. Because I can't just say, hey, let's take your gallbladder out. I can't just have surgery because with my heart, I can't just be put to sleep. I can only be sedated. Anyway, this cardiologist is the reason that I was not sedated when that drain tube was put into my stomach, into my gallbladder. I was fully awake. A month later when I had to go back and size up the tube. And then I was awake a month later after that to get my gallbladder flushed out and to take the drain tube out. I was awake for every bit of that. Every bit. And I really don't want to be awake when I go have this other procedure done. I really don't. But like I said, when they done the heart cath, they sedated me to see how well I handle it. And they said I've handled it fine. So I'm not gonna, listen to this cardiologist because he's like, oh no, you probably can't have that done, or that, they won't be able to do it, because, he just, I don't know. And I kept telling him, well, the whole reason they sedated me during this heart cath, because normally they don't. They never have with me. I've always been awake. But the reason why they did sedate me is to test out how well I handled this sedation, and they said I done fine. So you're not gonna be like, well, no, you can't have this done, or no, you can't be sedated when they do this procedure. He's talking about, like, maybe just getting me, like, a spinal, like, numb me from my waist down. Now, I've had that done before, very long time ago, or something else, but still, I don't want to be awake. I don't want to know. I just want them to sedate me, do the procedure, wake me up, and be done with it. You know what I mean? So, but anyway, hey, Jennifer. Yeah, I've just been so tired. I stay tired all the time. I finally got my home health approved. I'm just waiting on a call from them sometime this month to get things set up. I should be receiving my meals sometime soon, because I get 2 meals a day. Hopefully I'll hear from them soon and get this home health set up so I can have some help keeping up with cleaning the house and stuff like that, because I've been getting behind, and my fiance Jeremy, poor thing, he works and then has to, come home and cook and clean and everything else, and it's just all put on, the majority of it's put on him right now, and I mean, I do what I can, but the majority of the time I'm just completely just wiped out. I'm gonna try to start streaming more. I am on Twitch. I don't know if any of y'all have Twitch, but if you are, follow me on there. It's MJ198420. You can look me up by that. But like I said, I want to start streaming. I want to start working on, like, some art projects and stuff like that. I've got to get me a webcam for my laptop so I can do, like, a split screen. But until then, I'm going to try to start, streaming on here, giving updates, maybe streaming on YouTube, trying to stream on different places, a couple different places, so everybody's got access to when I do stream, when I go live, or if I'm just out and record a video and post it or whatever. Because with my health getting worse like it is, and I can't always just keep in contact with everybody, and I figured just do it here on Facebook, and then, I just figure out how I can give everybody a notification that I'm fixing to go live, which I sent everybody a notification anyway that I thought who would like to watch. Thank you, Christy. We are having a family reunion on May 24th, what we're planning in Mississippi. I've got the name of the place we're doing it, because we're going to do it in a park in Iuka, I think. If you want to come, you can, because you are a family. I'll give you the information, the details if you want. We're all trying to have everybody bring something. That way, not just one person is out more than everybody else. And we're trying to do it in a place mainly as close to me as possible. but kind of to where everybody else can come too. I know not everybody's going to be able to come there, but that's what we're planning for, is to do like a family reunion. Like I said, if you want to know any more about that, Christy, please just send me a message through Facebook, and I'll let you know the info on that, and maybe figure out, because my sister made a list of a little itemized lists for people that come, what they can bring. Kind of do like a potluck kind of thing, but you know, she's got little lists made out for everybody, and you can pick which one you want. I can share that. I can give you her information, or she's on my Facebook too, to get if you want more details about it or whatever, because she's the main one that's getting all this together, and I'm trying to help get it together as much as I can. But anyway, that's basically just what I wanted to get on here and do, is, you know, give the correct information. Like I said, some things that were posted, and some things were just misunderstood, and that's fine. It happens. But as soon as I get, you know, some more information, find out more what's going on with me, I will do another post. I'll go live. I'll try to, you know, send out notifications so people can know that I'm fixing to go live. Or if I'm not at home, I'll just record a video and post it, or try to go live. It depends how well Wi-Fi is when I'm not at home, because I'm connected to Wi-Fi here. Anyway, Jennifer, I'm going to try my best to get back to church. I know I haven't been in a while, and I've been watching your post, what's going on with you and your husband. And I've been meaning to reach out to you and let you know I've been through exactly what you went through. I was with someone that had to have the same thing done, so I completely feel on that. And I know it's not easy. I hope and pray he's doing better. I know after the last post I seen, I think you said that he was home, so that's good. I'm hoping this medicine helps me so I can feel like getting up and getting out and doing more. Because I want to try to do as much as I can. Because, like I said, I know eventually I'm going to need a heart and lung transplant. Sooner or later. I'm hoping later. I really don't feel like I'm there yet. But if I ever do feel like I am, then believe me, that's going to be one hard decision to have to make. Because there's a lot of risks with that. Especially if, by chance, I do need a new liver, which I'm really hoping I don't. I'm hoping there's something they can do about it. Because I think a heart, lung, and liver transplant would be super risky, totally unheard of for that to be done all at the same time, because that's how it would have to be done with me. But anyway, like I said, I just wanted to get on here and, you know, let everybody know the details of what's going on exactly from me directly. Because I know a lot of people were freaking out that that picture that was posted of me in the hospital, that was like shortly after they woke me up after the heart cath procedure last Thursday. And I kept asking them. I'm like, my mouth is dry. Can I get some water, some ice, something to drink? And you can see that little cup in my hand. Well, I had just gotten that cup of ice, so I was enjoying some ice because my mouth was super dry. But that was literally just after they woke me up. You can see I don't know if you can see that little spot on my neck. They went through my neck, and they went, let's see if you can see that. That little spot right there. Is that where they went through on my hand? That's where they went through on my hand. To do the heart cath, to, put the little wires or leads or whatever you want to call them into your heart. And like I said, they checked for blockages. There were none. And they also checked the pressures in your heart that way. I've never had a heart cath done that way. I've always had it done through the groin area. But I already told them, with this right here, with y'all going through my neck, I'm like, y'all are going to have to do something to calm me down, because I'm going to freak out. Because I don't like the idea of a needle or anything coming, being put in my neck, so I was like freaking out a little bit. And they're like, oh, we're going to take care of you. You're good. The last thing I remember was them putting these really cold patches for some reason on my back and on each side of my back. And I'm telling you, they were ice cold. And I was like, oh my God, because I was like, I'm real sensitive to cold like that. And that's about one of the last things I remember. And next thing I know, I was out of it. I don't remember a thing. So, and then I remember them waking me up in the recovery room and everything. So, but yeah, that's pretty much it. I know I've repeated myself a few times, but I know we've had people coming in and out on here watching. Hey Kyle, I just want to say congrats on the new baby girl. She's so precious. She's so cute. We're going to try to get out there as soon as we can to come see her. I don't know. Another update. Just not last night, but the night before. My fiance was in Huntsville, and he got into an accident. It pretty much totaled his car. So we're down to just my vehicle and then the truck. So he's having to file that through insurance. I'm hoping he gets something back to put towards another vehicle, because we both need our own vehicles. He's having to use my vehicle right now. Nobody got hurt, thankfully. But somebody he was turning at a green light, and bam, somebody hit right in the passenger front end. And I had to go pick him up and everything, but thankfully nobody was hurt. That's what's more important. So, hey Reagan, I was just saying to Kyle, congratulations on the new little baby girl. Oh my gosh, she's so precious. I so want to come see her as soon as I can. Hopefully when this weather clears up and we quit having all these storms and stuff, because they affect my pain a lot. So I hurt a lot, especially when it's fixing the storm and everything. But yeah, I'm just sitting here at home right now. Just chilling with my dogs. We got Chief. Say hey, Chief. There's that pretty boy. He's tired. And then we got baby girl. She's the old one. She's about 13 now, I think. Baby girl, say hi. She's a pretty girl. But anyway, hey Heather. Oh, girl, ain't seen you in a while. We're gonna try to do a family reunion. Oh, I don't know how you use captions on here. While we wait for the coaches to finish up, let's get into the battle of the sexes. Does anybody know how I do captions on here? Because my friend Jessica is deaf and she can't hear me. I tell Big Jazz all the time. Yeah. He kind of gave an accurate portrayal of what it's like to actually be a female working in a tattoo shop with other dudes. That's why I say he'll hear some tattooing. If you don't have the spine to stand up for yourself and take no crap, then don't be here. Wow. Okay. I made a response to Jessica because I don't know how you do captions on here. I don't know how to do captions on here so she can understand me. If anybody knows, y'all, if I'm glitching any, I'm sorry. It keeps saying slow connection. I tell you what, I'm going to go in the kitchen. It's going to get dark for a minute, so hold on. I'm going to go in here by the Wi-Fi router and see if that'll be. Oh, we got a possum out here, y'all. Can y'all see that? I don't know if y'all can see that or not. One of the possums is out there eating cat food. I put cat food out for the stray cats that come around here. Ooh, excuse me. Alright, I'm going to turn the big light on. Okay. Oh, okay, I don't have one. Okay, I don't know why it's still saying slow connection here. I'm right by the Wi-Fi thing. I'm right by the Wi-Fi thing right there. But yeah, okay. He's not out right now, but we've got a pet snake. I know not everybody likes snakes, but we got a pet snake, and he's a sweetheart. Can't see him right now. He's in that log in there. But, he's a sweetheart for a snake. He's really nice. Snake. Anyway, I'm just sitting here at the house now. I'm gonna turn this big light out, so I'm gonna go back in my room because I don't think it shouldn't matter as far as the Wi-Fi. It's supposed to be through the whole trailer. Anyway, if I'm lagging or anything, just let me know because I'm walking back to my room. Oh, I need to put some more. Hey, sorry about that. Hold on. Sorry about that. I accidentally paused it. Sorry, y'all. Sorry, y'all. I was trying to show y'all this possum out here, y'all. Y'all see it right there? I don't know if y'all can see that or not, but like I said, I put cat food out for the stray cats that we have around here. And the possums come eat, so I don't mind. They need to eat too. But hold on a minute. Hold on. I thought I sent her a notification. Sorry about that. I was replying to my other sister, let her know I was on Facebook Live. She was asking how I was doing, how I was feeling, rather. I don't know if she's going to jump on here or not, but for anybody else that does want to know, there she is. I'm dealing with a little bit of pain right now, just in my lower left side of my stomach. That's it for now. My legs were hurting earlier. If my blood sugar's a little high, it makes my legs hurt sometimes. Hey, Lindsay, what's up? No, I've just been explaining about everything that's going on. So I had the heart cath last Thursday, a week ago today. They didn't find any blockages. The pressures in my heart is elevated, but that's usual. That's normal for someone with my conditions. He mentioned a heart and lung transplant, which I don't think I'm ready for yet. So I'm not going to push that yet. We're going to try an inhaled medication. We're working on getting that set up now. There'll have to be a nurse to come out and show me how to do it and everything, because it's a specialty medication that has to be shipped to you through the mail. You can't just go to the pharmacy and get it. We have to make sure my insurance covers it. And if not, then I can get extra help to cover anything the insurance doesn't cover. They did give me sedation to test that out for when I have this other procedure for the fibroid that's on my uterus. I've already started medication for it to it's kind of meant to kill it off. And then when they do that procedure, I'm not sure when I'm going to be having that procedure done. I'm going to have an MRI this Saturday so they can get a better look at it, to see where they need to go in, because the procedure, they're going to partially block off blood flow to the fibroid to kill it off and everything. So, that's the news on that. I am going to a liver specialist in August because I think last month I had, an ultrasound of my upper abdomen because some of my blood work was off, and they wanted to check things, and then they noticed a change in my liver. They did mention cirrhosis. I don't think they were definitely saying cirrhosis, but there's something going on with it, and so they're going to send me to a specialist to get that checked out. So I do not know if I need a liver transplant or not. I will find that out probably in August. But for now, we're trying to get me started on this new breathing medication for my lungs. And started on that other medication for the fibroid. And then I have the MRI this Saturday to get a better look at the fibroid, I guess, to get more detail about it, to see, like I said, where they'll have to go in, because they'll have to go in through an artery and go in and partially block blood flow to the fibroid to kill it off. I don't know what all I'm going to have to deal with after that, because I've heard some things. I've talked to some other women that have dealt with this on a group about just fibroids, and I've been hearing different things and different experiences and stuff, so I can try to get an idea of what to expect. So I will definitely one day need a heart and lung transplant. I will put that out there. But I do not feel it's time yet. Not sure about the liver yet. I will find out more about that in August. And for now, I'm having the MRI done this Saturday to get a better look at the fibroid, and then go from there. And then sometime soon, we're working on getting the new breathing treatments in. I'll be doing that 4 times a day. A nurse will have to come out. Hey, Ricky, what's up, man? Man, it's been a long time since I've seen y'all. I miss coming over and hanging out with y'all and stuff. But thank you so much, Ricky. Get this new breathing medication started and make sure, we can get it covered by my insurance, and a nurse will have to come out and show me how to do it, because it's a specialty medication. It's not just something you can go to your local pharmacy and get. It has to be specially ordered and shipped through the mail to you. Still working on that, and already started the medication to go ahead and start treating the fibroid that's on my uterus. I did get home health approved for home health, so I'm waiting on a phone call from them to get things set up. Sometime this month they're supposed to give me a call so I can get help around here, because I stay tired all the time. I can't sleep most nights. And so I kind of get behind around the house, and that's just putting it all on my fiance, and he has to work too, so it's going to help both of us. But that's just the majority of it right now. Like I was saying earlier, I know some people just got here, and I'm going to try to start doing this more often to keep everyone updated on my health and everything. And thank you, Tammy, by the way. I miss coming over to y'all's house and hanging out and partying and stuff. We sure had a good time. I had fun. But anyway, I'm going to try to start doing this more so y'all can get the information directly from me, so there's no other misunderstandings. That picture of me that was posted on Facebook. I was in the I just got in the recovery room after I had the heart cath last Thursday up at UAB in Birmingham. I was in recovery. I was just waking up. I repeatedly kept asking them for like some ice or something to drink, so my mouth was really dry, and I just got that cup of ice that I was holding, and I was enjoying, right in that moment, I was enjoying some ice because my mouth was super dry. But yeah, but you can see in that picture where they had went, like I said, I showed earlier, they went through my neck, and they went through my hand right there. And you see it's bruising a little bit, but they went through there too. So, to do the heart cath. Usually, any other time I've had a heart cath, they went through my groin area, but this time, because each area they check different things, so it can do different procedures and stuff if need be. But they needed to check for blockages, which, like I said, I didn't know they were checking for, but there were none, thankfully. And they needed to check the pressures in my heart, which, like I said earlier, they are elevated, which is normal for my health conditions. But they need to check. They're going to compare it to the last heart cath I had a very long time ago at Vanderbilt up in Nashville, Tennessee. They're working on getting those test results so they can compare and see how much higher the pressures are in my heart. Of course, some of you don't know exactly my health problems. I have Eisenmenger's, which is 3 holes in my heart, which is what I was born with. I've got congestive heart failure. I've got a rare lung disease called pulmonary hypertension. Diabetic. I've got all other sorts of health issues on top of that. And this right here, if you ever seen me, ever met me, ever known me, you've seen this. This is textbook clubbing. If you look up clubbing in fingernails or toenails, this is exactly what you'll see. And that's because of lack of oxygen, because of my pulmonary hypertension. This is something that's very rare to see in person, in real life. Any doctor will tell you that. I've had doctors bring their students in to see it or take pictures for one of their seminars or classes, because it's so rare to see something like that in person. So yeah. But yeah, I'm gonna try to start doing this more often so I can keep, everybody updated all at once, instead of having to try to explain it a million times to every single person. So, also, like I said earlier, if you have Twitch, I do stream on Twitch sometimes. I haven't been here lately, but I'm going to try to set things up. I'm going to try to set it up to where I can do a split screen, because I want to start doing like some art projects and stuff on Twitch. My name on Twitch is MJ198420. I believe that's what it is. Just look me up on Twitch if you're on Twitch. If not, I'll be streaming on here. Whether it's live or if I post a video, or I might go live or post a video on YouTube. So I also got a YouTube account, as most people do. And thank you, Lindsay. I hope, get to see all y'all soon on the 24th. So we can spend time together and everything. And like I was saying, I just figured this would be a lot easier to just do a video and explain things myself and let y'all know what's going on, because I know some people were freaking out earlier because of that picture. That does look scary. It is scary kind of having to go through all this stuff and deal with it, but I know I've got a lot of friends and family that, if anything, they can pray for me. Have me in their thoughts and stuff. But I plan on taking y'all on this journey with me, no matter what happens. So, yeah. That's pretty much it. I appreciate everybody that has come on here and are watching me and have offered prayers and everything. I really do appreciate that. Um, you know, having to deal with stuff like this is not easy because the majority of the time you're alone and don't always have somebody you could just reach out to. But now I know, well, I've always known, I could just, get on here and just start talking, and whoever wants to watch, whoever wants to listen, they can. Nobody's obligated to, but I appreciate all that are watching and are giving their love and support for me. It's I don't know, just hoping things go the best that they can for me. Like I said, I will find out more about my liver in August when I go see a specialist for it. They'll do blood work, another ultrasound of my liver and everything. I know that the only thing sometimes about having to go to these specialists and stuff, so it takes time to get in to see them because they see so many people. So, but yeah, I'm gonna repeat everything one more time. There was discussion about a heart and lung transplant. Yes, I will eventually need one. I don't feel like I need one right now. I don't think it's to that point. I've always known, as far back as I can remember, I've always known that I needed a heart and lung transplant. I've known that. Most people that know me probably have known that. Not sure. But that's just it. But I really don't feel like now's the time for that. We're going to try some medications. A medication that I have to use like a breathing treatment 4 times a day. We're working on getting that going. I'm having an MRI done this Saturday for the fibroid that I've got on my uterus, so they can get a better look at it to prepare for a future procedure to hopefully help kill it off and get rid of it because it's causing me pain and other problems. That's what I've got coming up. Let's see. Like I said, my liver, I won't know anything until August unless they have somebody cancel and fit me in sooner than that. But as of right now, I'm started on the medication for the fibroid, doing the MRI this Saturday. Yes, there's a place that UAB is affiliated with that does MRIs on Saturdays. I know that's crazy, but yeah, and I'm even going to be able to get a ride up there and not have to drive myself. Because I finally got the insurance where I can get provided transportation. They extended their mileage because before their mileage wasn't far enough for me to be covered. But now I am, so I don't have to drive myself to these appointments all the time. Because it wears me out driving, even riding for long periods just wears me out. And let's see, I'm waiting to hear back from Home Health because I did get approved. Waiting to get that set up. Waiting to get that breathing medication set up. Already started on the medication for the fibroid. I'm just trying to cover everything for anybody that's just come on here. I'll know more about my liver in August. I'm hoping I can get the doctor to call in something for me for the MRI Saturday because I panic. I'm real bad claustrophobic, and I panic. Because you have to be in the MRI for at least like 20 minutes. You have to lay flat and still for like 20 minutes. And I'm telling you what, I can't do it. It's so hard for me to do that. So I'm going to be on the phone. I've already called and let them know. I've already requested something that I can take to kind of calm me down and relax me. Because if not, I'm going to be in there and I'm going to start panicking. I'm going to be like, let me out, let me out, let me out. I'm going to be like, not screaming, but I'm going to be like really loud. Like, get me out of here. Because I can't even have an open CT scan done without panicking. I don't know why. Because it's open. It's just like a donut and you're stuck in the middle of it. You ever had an open CT scan? They have open MRIs too. But I still panic. I don't know why. I guess the loss of control of the situation. Knowing you're stuck there and you can't just get up. Because usually they strap you down. So you can't just get up. And I know with the MRI, once you start it, that's it. If they stop it, if they stop it in the middle of it, they have to start all over again. So that means you have to spend even longer in there. And I just want to get it over as soon as possible. And I know from experience, it usually takes at least 20 minutes for them to get a good image of what they need the image of. And that needs to be done. So hopefully we can get this procedure set up so we can get this thing taken care of. It's not going to be anything immediate. It's just going to be over time. You know, I don't know. I'm not going to say it's going to be a pain-free journey. I'm sure I'm going to have to go through some painful stuff to get rid of this thing, but that's okay. I deal with pain every day, so I can't say I'm used to it, but I'm not used to it, but I'm used to it. You know what I mean? It's just an everyday thing. You know, you expect it. You expect it. Oh, me. I don't even know what time it is, y'all. How long have I even been over here? I've been on here for I've probably been on here for like an hour. So, so anybody got any questions about anything? If they didn't understand anything or want me to repeat anything or re-explain anything, just feel free to ask. And if not on here, if you want to send me a private message, feel welcome to anytime. I'm usually up all the time anyway. I hardly ever sleep. If I do, it's usually mid-morning to afternoon time when I am asleep, if I am able. Here lately, I've got fibromyalgia, so with all this weather and rain and storms and stuff, and it's just been making that flare up. Okay, what's up, girl? Okay, alright, I'm gonna go over everything one more time. Because my niece just got on here. Okay, last Thursday, I know you've seen that picture that's been on Facebook. That was of last Thursday after I had a heart cath. I had the heart cath because they needed to check the pressures in my heart to see if they had gotten any higher than they were the last time I had a heart cath. They're still working on comparing the results of those tests. I seen the cardiologist Monday. He did mention a heart and lung transplant, which if you know me, you've known for practically my whole life, I'm going to need a heart and lung transplant, okay? I don't feel it's time for it right now. So we're going to try some breathing medication that we're working on getting me started on. here probably maybe in the next week or so, hopefully, to see if that will help with me being tired all the time and everything. Because I stay tired. I got approved for home health. I'm waiting on a call for that to get that going. This Saturday I'm going for an MRI of the fibroid that's on my uterus. I've already started on medication to help shrink it, pretty much. And then the MRIs to get a better look at it, so they know how to approach it when they do this procedure where they go in through an artery and partially block off blood flow to the fibroid that's on my uterus to help kill it off. So that's what the MRI is for this weekend, so they can get a better look. And once I have that done and they look at that, then the next step will probably be setting that procedure up. I don't know how soon that's going to happen yet, until after this weekend. I should probably know something next week about that, probably. Let's see. I will not find out anything about my liver until August. It's not a definite that I need a liver transplant. There's a miscommunication with that. He misunderstood, but that's fine. There is something going on with my liver. They've noticed some of my blood work was off, so they ordered a abdominal ultrasound up at UAB, and they noticed a change in my liver. They did mention cirrhosis. Don't know if that's a definite thing or not. That's why they're going to send me to a liver specialist in August up at UAB. Let's see, what else? I did mention I'm already on the medication for the fibroid. I do the MRI this Saturday. I'm starting on a new breathing medication soon. It's a specialty medication. Somebody has to, me too, Lindsay. I love you too, and can't wait to see you here in a few weeks. What was I saying? I lost my train of thought. That happens a lot when you get old. I'm trying to cover everything again for my niece, because, like I said, she just got home from work. Let's see. Just trying to think. Like, for real, if y'all got any more questions, just feel free to ask. Send me a private message, whatever. If you got any more specific questions. But I mean, that's the gist of it. Just waiting for things to get going. There'll have to be a nurse to come out to show me how to use this new breathing medication, because it is a specialty medication. You ain't gotta do that, girl. I know you would. We're doing a family reunion on the 24th in Mississippi. Girl, if, I know your mom's supposed to be trying to come down. I don't know how things are going with y'all right now, but, I mean, that'd be cool if, I'm sure you would, but I don't know, can you go without a liver? I don't think you can go without a liver. Hopefully I don't need a new liver. Hopefully it's something that they can treat. I know when you say cirrhosis, a lot of people think, well, alcohol. Well, no, it's not from alcohol. I'm thinking it's from some of my medication, because between my pain medication that can cause liver damage and then one of my lung medicines that can cause liver damage, I have a liver function test done every month to keep a check on it. And so that's how they caught it. Hopefully they've caught it early enough to where they can treat it and not have to do a transplant, because a heart and a lung is going to be hard enough, and a liver on top of it. It's very uncommon for them to try to do 3 organs at once. And I'm not, I mean, I've been told I'm strong and brave, but I don't know if I'm that brave to attempt that. I don't know. Like I said, it's going to be on the 24th. If you want to try to come, let me know. I can give you where the location in Mississippi it's going to be. We're going to do it at a park. We're all trying to pitch in and bring something. Teresa has made out a list of items that each person could bring. It's a list of a few items each of, stuff that each person can bring. That way we all pitch in and everybody has enough of everything and we can all eat and have drinks and this, that, and other. I've already got my list of things to bring. Hey girl, what's up? Okay. Do I need to go over this one more time? Okay. I had the heart cath last Thursday. I seen the cardiologist. And then that picture was of me in recovery after that heart cath. That's what that picture is of me. And then Monday I went and seen the cardiologist. No blockages. Hey, Lori. No blockages. Pressures are elevated in my heart, which is normal for me. He did mention a heart and lung transplant, which eventually I will have to have that done. I don't feel it's time for that yet. So we're going to try a new breathing medication for that to see how that goes. I'm going this Saturday to have an MRI done to get a better look at the fibroid on my uterus, to prepare for a procedure that they're going to do, where they go in through an artery and partially block off blood flow to the fibroid to help kill it off. I also just started a few days ago on a medication to help shrink it and to help kill it off and everything. Because they said the size of this fibroid is almost taking up my whole uterus, so it's not anything small. And because of my heart and lungs, mainly my heart, I can't be put to sleep, so I can't just have it surgically removed. We have to try this medication and this other procedure first. So I'll find out more about that after I have the MRI this Saturday. I'll probably hear back about that next week after they get the results of it. I will know more about my liver in August when I see a liver specialist. What happened with that was because I have to have a liver function test done every month because of one of the lung medicines I'm on, because it can cause liver damage. And I guess some of the numbers were elevated or something. And so they ordered an abdominal ultrasound for me to go up there and have done last month sometime. And they noticed a change in my liver. They mentioned cirrhosis. They didn't tell me that that's definitely what it was, but they did mention that. And you can get that from other things, not just alcohol. 'Cause I do not drink. Very rarely, if at all. Um, so, if anything, it's got to be caused from some of my medications. I will go see a liver specialist in August. They'll do blood work, another ultrasound, and then I'll see the doctor. And they'll let me know more about what needs to be done about that. But for now, I'm just taking this new medication for the fibroid, getting the MRI done Saturday, and then I should hear back probably next week about that, when possibly they'll be trying to set up for that procedure, and everything. So I did get approved for home health, waiting to hear back from them to get that set up. I'll also get 2 meals a day through that. I don't know when I'm going to be getting those, but they said I should be getting them soon. Because when they called, they actually called me last Thursday and told me I got approved for it. I literally just got up to UAB to have the heart cath done, and they're calling me and like, we didn't let you know you got approved for your home health, and we're going to go ahead and get these meals sent out to you, and they'll be calling you within this next month to get things set up. And I'm like, that's awesome, because I really need the help around here. I stay tired. I hardly sleep. I deal with a lot of pain. So I'm getting behind on things here at the house. So I need help with that. And that will help my fiance Jeremy also, because that way he won't have to be, because he has to work and then come home and cook and help clean and all that stuff. And that's just a lot on him too, because see, he's partially disabled as well, so, he's got his own health problems he's got going on, so, we're trying to, help ease things up on the both of us, so, and lower our stress level, because stress can make you sick, like, for real. Everybody should know that. Stress can make you really sick. So, we need to keep the stress level down and finally get the help that we need and everything. So, but that's about it, y'all. I mean, for real. For anybody that went on here earlier, I'm going to try to start doing this more often and, doing updates on my health and everything, because I think this would be easier for me to come on here and explain everything myself than other people try to explain it, or for me to have to keep, writing in a message to every individual what's going on, because it's just really time consuming and tiring to have to just keep writing all that stuff over and over and over, when it's so much easier for me to just come on here and just tell y'all what's going on. Y'all, my hair is crazy. But yeah, I mean, that's pretty much it, y'all. I mean, this is what I'm usually doing. I'm usually just sitting here, just chilling, watching TV, watching movies, shows, whatever. Hey, Christina, what's up? Man, everybody's jumping on here now. That's great. I don't even know how many people I've got on here just watching me right now. Okay, Christina, you just got on here. Let's go over this one more time. I had a heart cath done last Thursday because I've been staying more tired, like, all the time. more tired than usual. So they done the heart cath. They checked for blockages. There were none. They checked the pressures in my heart, which is elevated, which is normal for my health problems. I seen the cardiologist Monday. He did mention heart and lung transplant, which I've known the majority of my life I will need a heart and lung transplant. I do not feel it's time for that right now. So we're going to try a new medication, a breathing medication, to see if that'll help me. They're working on getting that started. I have already started a medication for this fibroid that I have on my uterus, to help treat that. To go ahead and start working on killing it off and shrinking it and everything. This Saturday I go have an MRI so they can get a better look at it for when they do this procedure in the future, where they will go in and they will go in through an artery and they will partially block off blood flow to the fibroid, which will kill it off. And hopefully all that works to help get rid of this thing, because it's causing me a lot of pain and a lot of other issues. I don't know about my liver yet. I see a liver specialist in August. They'll do blood work and another ultrasound. The whole reason, I take a liver medication that can cause liver damage. I'm also on pain medicine that can cause liver damage, but because of the lung medicine I'm on, I have to have a monthly liver function test done to check my liver function. And I guess some of the numbers were off, so they ordered an ultrasound of my abdomen. And that's when they found a change in my liver. They mentioned cirrhosis. They did not say that's what it was. They did mention it. So, therefore, I'm being sent to a liver specialist in August where they'll do labs, another ultrasound, and then I'll see the doctor. And then I should know more about that then. So, that's the gist of it. I got home health approved. Waiting to get that set up. Waiting to get this new breathing medication set up, because the nurse will have to come in and show me how to use it. It's a specialty medication. It's not just anything you could go to the pharmacy and get. They have to ship it to you. Just like my lung medication that I'm on now, it has to be shipped to me, because not just anybody has it. It's a specialty drug. I have to make sure I get my insurance covers the new medicine. If I need any help with it, get help with to cover the cost. But that's basically what's going on right now. And I'm going to start doing this, either going live, posting videos on either here or on YouTube or on Twitch. I'm wanting to start streaming on Twitch, working on some artwork and, art projects and stuff. I haven't gotten around to it yet. I need to get a webcam for my laptop, because I want to do a split screen to where you can see me and see what I'm working on too. So, I think I need to get a webcam for my laptop, because I did get my laptop fixed finally. To where it works good enough to where I could, load Twitch on, I could load Twitch on there and everything, and I want to start doing that soon. And, y'all just pay attention. I'll start sending messages out, and letting people know if and when I'm going to go live. When I hear something, or if I just want to maybe check in with y'all or anything. Because I just feel like that it's easier this way to explain things to more people at once than have to send individual messages, because it is a lot of stuff going on right now with me. Um, but but yeah, that's about it, y'all. If y'all got any questions, please feel free to ask me on here or send me a private message. I will answer it as soon as I can. Y'all just keep me in your thoughts and prayers, because depending what I find out, it may not be something I want to hear, or I'm not ready for, or it's not going to be easy, because it's never easy when you deal with a lot of health problems like I do, or a lot of pain, or anything in life that, things aren't going good. It's not easy. And it's just good to know that I have so many people on here that, I didn't know how many people were actually going to jump on here and listen to me repeat myself over and over again about the same thing. But, as more people jump on here, I have to, explain things again, because they might not have heard everything I said to begin with. And I want everyone to know, what's going on with me right now, because I've seen a lot of people getting worried and freaking out when that picture was posted of me and everything. And yeah, that is a scary looking picture. But I don't know, y'all. I think that's probably gonna be it. Checking on my dogs. They're just snoozing over here. I wish I could sleep like they do. Thank you, Crystal. Thank you so much. I will be, if I don't go live or I don't post a video, I will make a written post when I find something out, or whatever. Like I said, I'm going to try to start doing this more. To keep everybody posted and updated on exactly what's going on, so there's no confusion or misunderstanding about anything. I don't want, everybody to get too worried yet. If it starts getting down to time to get serious, then it's time to get serious, and that's what we'll do. And I will need all the love and support and help I can get. And I think it's a good thing that I finally got home health approved, and going to get that started sooner rather than later, because I've never really pushed to get it. But I have this time because I really need the help. We both need the help. A dirty house can just ruin your day. You know what I mean? Just especially if you're tired, you get home, you're tired, and you're like, oh, the last thing I want to do is clean house, right? Yeah, okay. Well, that's how I am. I wake up tired. That's if I'm even able to go to sleep. I hardly ever sleep. I might get a few hours a day. My hair, y'all. Oh. I might get a few hours a day, if that. Some days I can't sleep at all. Especially at nighttime. Especially with all this rain and the weather, the storms, and all that stuff's been flaring up my fibromyalgia. My legs have been hurting a lot. But But yeah, I just wanted to get on here and update everybody. I'm sorry if this is breaking up or anything. It keeps saying slow connection. Because I'm on Wi-Fi at my house. Anyway. Y'all, I'm wore out. And I haven't done anything. I did go to town today. I had to get a few things done. Because my fiance was... Sorry about that. He was just trying to call me. As soon as I talk about him, I swear he tries to call me. He was in a car accident, I think Wednesday night. Tuesday or Wednesday night, I can't remember. He was taking a left at a green light and somebody hit him. I'm pretty sure the car is going to be totaled. He's fine. The other people are fine. Nobody got hurt, thankfully. But he's just having to use my vehicle at the moment until we can get, the claim through our insurance, and hopefully they'll be able to help him get a new vehicle. Because he needs his own vehicle, as I need my own vehicle. I don't really like... I mean, we've got the truck out there. If I really needed to go somewhere, I could go jump in the truck. But I like my vehicle. I'm sure y'all understand that. But yeah, I think I'm fixing to get off here. I appreciate y'all for tuning in. And, like I said, if y'all got any questions, don't hesitate. Oh my God. Hold on. Y'all, there's a bug in here. Oh my God. I hope it's not a stink bug, y'all. I can't stand the smell of them things. What was that, Chief? Chiefy. He's a pretty boy. He's a pretty boy, Chief. He don't like bugs either. But, yeah, if you got anything you want to ask me, just don't hesitate to send me a private message. I'll answer it as soon as possible. I'm usually up. The main time I'm trying to lay down is like in the morning to the afternoon is when I'm usually trying to rest. If not, then I'm up. I mean, sometimes if I'm hurting or my legs are bothering me or whatever and I can't sleep, I can't sleep. You know what I mean? I toss and turn a lot because of my pain. And, sometimes I can't sleep. So, I mean, just message me anytime because you never know. It's a good chance I'm probably up. And if I don't answer you, then I'm either not right by my phone or I'm trying to sleep, and I will get back to you. But I think I'm going to go ahead and jump off here for now, and I'm going to try to lay down for a little bit because I am tired. I know I stay tired. But if I could try to lay down and maybe get a little bit of sleep, that would be great. I know Mother's Day is coming up this weekend, so I will wish everyone a happy Mother's Day, early Mother's Day. Planning on going to see my mom this weekend. And everything. So y'all, if your mother's still around, go see her. If not, go see her. Do what you can. But anyway, I'm gonna go ahead and jump off here and try to get a little bit of rest. Just getting out doing a few things just, oh, it totally wipes me out. So, oh, I know, y'all, sorry. But I appreciate everybody that is watching right now, and I hope I've explained things thoroughly enough for everyone to understand what's going on with me right now. I will do my best to keep y'all updated as much as possible, and when I find out something, I will go live or post video. I will send everyone that has come on here tonight, I will make sure I send you all a notification when I'm going live. So if you can tune in, that'll be great. But I know I've probably been on here over an hour already, so going to probably gonna find me something to watch and just rest for the rest of the evening. And hopefully get a little bit of sleep so I can feel like maybe getting some laundry done, or load the dishwasher and get some dishes done, or something simple like that. But y'all, I appreciate y'all so much, and thank y'all for tuning in, and y'all will see me again soon. As soon as I find out something, I think I should find out more next week, hopefully, about when this procedure is going to be done. And medications I'm starting on, and home health is what I'm waiting to hear about this coming month. So I will give updates as I'm able to, as I find out. And thank y'all, everybody, for your prayers and thoughts, and joining me here this evening. So I can let everyone know exactly what's going on. Like I said, I know there was some misunderstanding and some confusion with exactly what was going on, and I just felt I needed to come on here and explain exactly what was going on, because I know some people were freaking out, because they didn't know exactly what was going on. So, but y'all have a good night. I'm going to try to have a good night. Like I said, if you want to ask me anything or tell me anything, you can send me a private message, because everybody on here is on my Facebook friends list. And if you're not, you're not my family, then I still consider you family, because I don't just add anybody to my Facebook. It's mainly from my close friends and family that, that are in my life and that I care about. So, but anyway, I enjoyed y'all tuning in and letting me explain things to y'all. And I'm gonna go and relax for the rest of the evening. And y'all have a good night too. Alright, send me a private message if you want to. I'll be here. Alright, we'll see y'all later. Good night, everybody. Till next time. Peace.